My name is Dr. William, and I want to start with a number that is going to stay with you. Every 66 seconds, another senior in this country receives a dementia diagnosis. By the time this video is over, roughly 20 more families will have heard those words. And for some of them, the real cause was never their age. It was a pill sitting on their bathroom shelf, a pill a doctor prescribed, a pill a pharmacist filled, a pill they were told was safe. In my 15 years of practice, I have watched this exact story unfold more times than I can count. Someone sharp their entire life starts losing the thread. Names disappear. Appointments are missed. A drive they have made 1,000 times suddenly feels unfamiliar, and everyone around them nods and says the same thing. It must be getting old. It was not getting old. It was a medication. Here is what almost no one explains to you in a 1-2 minute office visit. There is a class of everyday drugs, some sold without a prescription, that can pull your memory and your ability to learn down hard inside a single year. Most people taking these drugs have no idea it is happening. Today, I am walking you through 9 medications most closely tied to rapid memory loss in older adults. We are going to count down from the ones that get quietly overlooked all the way to the one I consider the most destructive of all. And I want you to stay for number 3 because it is handed to millions of seniors for something that sounds completely harmless, and it may be shrinking the memory centers of your brain right now without a single warning sign. Before we go further, drop your age in the comments below. Tell me how old you are and which medications you take every day. I read every single one, and what this audience tells me shapes what I cover next. Now, let us start at number 9. And do not let the low position on the list fool you, because this one is sitting in almost every medicine cabinet in America. Number 9 is diphenhydramine. You know it as Benadryl. It is the little pink pill people reach for to fall asleep, to calm an allergy, to take the edge off a cold. It costs just a few dollars. It sits on an open shelf, and most people assume that because nobody needs a prescription for it, it must be gentle on the body. Inside your brain, it is doing something very different. Benadryl belongs to a group of drugs called anticholinergics. That is a long word with a simple meaning. These drugs block a brain chemical called acetylcholine. Think of acetylcholine as the postal service of your brain. Every time you form a new memory or stay alert through the afternoon, that chemical is delivering the message. As we get older, the brain naturally makes less of it and leans harder on every bit it still has. So a drug that blocks it hits a 70-year-old brain far harder than it hits a 30-year-old one. The part of the brain that takes the hit first is the hippocampus. That is the small seahorse-shaped structure where new memories are formed before they get filed away for good. Block its fuel supply long enough, and it starts to struggle. In my own practice, I have watched patients take a nightly antihistamine for years and slowly lose their mental edge, never once connecting the fog to the pink pill by the bed. The research connects it plainly. A 2023 paper in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs regularly and found a 54% higher risk of developing dementia compared with people who stayed off them. More than half, again, the normal risk from something most of us treat like candy. Here is what to do. Read the label on anything you take to sleep and anything marked PM, nighttime, or allergy relief. Those products are very often just Benadryl wearing a different name. If you take it for allergies, there are newer antihistamines like loratadine that do not cross into the brain the way Benadryl does and are far safer for long-term use. Never stop a medication on your own. Bring it to your doctor, but stop assuming that over-the-counter means safe for your memory. That is number 9. Number 8 is one your stomach loves and your brain quietly pays for. Number 8 is proton pump inhibitors. The big names are omeprazole and esomeprazole. These drugs shut down acid production in the stomach, and they get handed out for heartburn, reflux, and that burning feeling after meals. People stay on them for years, sometimes decades, because the moment they stop, the symptoms come roaring back. So it feels like the drug is the only thing holding the line. Here is the part almost nobody hears at the pharmacy counter. Your stomach needs acid to pull certain nutrients out of your food. Chief among them is vitamin B12, which protects the wiring of your nerves and your brain. Think of B12 as the insulation around an electrical cord. Without enough of it, signals short out. Turn stomach acid down far enough, long enough, and your B12 quietly drops. So do magnesium and calcium, two minerals your brain cells depend on to fire and signal cleanly. Starve the neurons of those raw materials, and you get misfires, confusion, and memory slips that look exactly like early Alzheimer's when the real cause is a nutrient your medication has been blocking all along. A large study published in JAMA Neurology in 2016 examined more than 73,000 people aged 75 and older. Regular users of these acid blocking drugs had a 44% higher risk of dementia than people who did not take them. And the trouble runs even deeper than nutrients because these drugs have also been shown to raise levels of amyloid beta in the brain, the sticky protein that builds up in Alzheimer's disease. Here is the move. If you take one of these every single day, that is the conversation to have with your doctor. Many people can step down to a gentler class of acid reducers that are far less likely to touch your thinking. The goal is the lowest dose for the shortest time, not a pill you take forever out of habit. Now, I know we have covered a lot of ground in just a few minutes, and I want to make sure what you are learning today does not just stay in your head. It needs to get into your hands, onto your kitchen table, and into your next doctor's appointment. I put together something called the Complete Senior Health Vault. It is a set of 3 plain English guides covering the medications worth questioning, the foods that act like medicine, and the manual for your body after 70. Everything I wish I had time to explain in the office, in one place. The link is in the description, and you can scan the code on your screen right now. It will be there for the rest of the video. And stay with me, because what is coming in a few minutes, starting with number 5, is the part of this conversation that most doctors never get to before the clock runs out. Number 7 is prescribed for a problem most people would rather not talk about. Number 7 is bladder medications, and the one to know by name is oxybutynin. It is given to seniors who deal with a sudden, urgent need to get to the bathroom. The kind of overactive bladder that can reshape an entire day. The relief it provides is real, and the embarrassment it spares people is real too. But here is what makes this one so troubling. Oxybutynin works by blocking acetylcholine, the same memory chemical Benadryl blocks, and this one slips across into the brain very easily, settling right where memories are made. In 2019, the British Medical Journal published a study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than a year. Their risk of dementia was 49% higher, close to 1 in 2. Let me tell you about someone I will call Donna, 74, from Columbus. Donna had been on oxybutynin for almost 3 years when her daughter started noticing something was off. Donna was losing her keys 10 times a day, forgetting conversations that had happened an hour earlier, and missing appointments she had written down. Everyone around her called it getting older. Her doctor eventually reviewed her medications and switched her to a newer bladder drug that works through a completely different pathway and does not block acetylcholine at all. Within 2 months, Donna's family said they had her back. Almost none of the patients on oxybutynin are warned about this. They are told a pill will calm the bladder. Nobody mentions it might be dimming the mind at the same time. If you take oxybutynin and you have noticed your memory slipping, take that seriously. You do not have to choose between your bladder and your brain. Bring it up at your next visit. Number 6 might be the most surprising one on this list because it is one of the most prescribed drugs on earth. Number 6 is statins. These are among the most prescribed medicines in the world, especially after 60, and they do an important job lowering cholesterol and cutting the risk of heart attacks and strokes. Statins belong in a lot of people's lives. This is not a case against them. What follows is the half of the story that usually gets left out. Cholesterol does far more than affect your heart. Your brain is close to 60% fat, and it uses cholesterol to build the insulation wrapped around every nerve. So signals travel fast and clean. Lower cholesterol hard enough with a strong enough statin, and you can leave the brain short of a raw material it actually needs. Think of it like stripping the rubber coating off an electrical wire. The signal still tries to travel, but it loses power along the way. A 2023 study in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment, and the higher the dose, the steeper the slide. Some patients described frightening blanks, a familiar name suddenly gone, a route they had driven for 20 years that suddenly felt foreign. The important thing to understand is that not every statin touches the brain the same way. Some cross into brain tissue much more readily than others. If you have been on a statin for years and you are noticing fog or forgetfulness creeping in, that is a real conversation to have with your doctor about dose or a possible switch. It is not a reason to quietly quit a drug that may be protecting your heart. Get the plan right with help, never on your own. And if you have been keeping count, you may have noticed something. Several of these drugs attack the exact same target in the brain. That is not a coincidence. That pattern is exactly what makes number one on this list so dangerous, and we are getting there. But first, number five. Number five is the benzodiazepines, lorazepam, diazepam, alprazolam. These are among the most widely prescribed drugs in America for anxiety and sleep. They work by boosting the brain's own calming signal, the chemical that turns down a racing, overstimulated nervous system. At first, they feel like a rescue. The panic eases, the spinning thoughts stop, sleep finally comes. Over time, the picture changes. A 2022 study in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used these drugs for longer than 3 months had a 51% higher risk of Alzheimer's disease. The longer acting versions were worse because they linger in the body and build up in fatty tissue, including the brain. What the drug is doing over time is a slow chemical sedation of the whole system. The brain learns new things more slowly. It grows less flexible. Many people describe a flatness, a sense of moving through fog, of not quite being themselves anymore. The cruelest part is the exit. Stop one of these drugs abruptly, and the anxiety and insomnia come back twice as hard. That makes the pill feel essential right at the moment it is doing the most harm. So here is the rule, and it matters deeply. If you have been on one of these for more than a few weeks, do not stop suddenly. That can be genuinely dangerous. Work with a doctor to step down slowly over weeks or months. Gentler options exist for both anxiety and sleep that do not carry the same cost to your thinking. And the code is still there on your screen if you want to take the full guide into your next appointment with you. Number four is a single pill prescribed for 3 different problems, and it carries one of the heaviest hidden burdens of all. Number four is amitriptyline. It is an older antidepressant that is still prescribed today for nerve pain, for sleep, and even to prevent migraines. That versatility is exactly why it's spread so quietly. It looks like a do-everything pill. Underneath that reputation, it is one of the most powerful anticholinergic drugs still in wide use. It blocks acetylcholine hard, the very chemical your neurons need to talk to each other and lock in new memories. It blocks it so strongly that with long-term use, the effect on memories stops being a rare side effect and starts being the expected result. A large study published in JAMA Internal Medicine in 2015 followed more than 3,400 adults aged 65 and up. Those with the highest cumulative exposure to anticholinergic drugs like amitriptyline over 10 years had a 54% greater chance of dementia, and almost none of them were ever told the pill could do that. They received it for sleep or for pain. then slowly noticed words going missing, memory thinning, concentration fraying, and they chalked it up to age. It does not even take a high dose. A small nightly amount taken for years can quietly erode brain power with no obvious warning until the loss is real. If you or someone you love takes amitriptyline, that is a conversation worth having soon. For nerve pain, there are options that give similar relief without the same burden on memory. For sleep, gentler alternatives exist. For mood, newer antidepressants are considered much safer for the long term health of the aging brain. Bring the conversation to your doctor. Never stop a medication on your own. Now, we are at number three, the one I told you to watch for. Number three is paroxetine. On the surface, it looks like the modern, gentle option for depression and anxiety, kinder than the older psychiatric drugs. And for many years, it was handed to seniors on exactly that assumption. Here is the detail they rarely mention. Paroxetine is the one antidepressant in its family with significant anticholinergic activity. That single fact sets it apart from its close relatives because it reaches into the same acetylcholine system that every other drug on this list has been chipping away at. A large review published in Frontiers in Psychiatry in 2021 looked at older adults on different antidepressants and found that paroxetine users showed measurable drops in short term memory, word recall, and attention within the first 12 months. Seniors on paroxetine were 30% more likely to show early signs of cognitive impairment than those on other antidepressants in its class. There is a hard irony in that the drug is given to steady the mind, and over time, it can wear down the very clarity it was meant to protect. In older adults, paroxetine is on something called the Beers List, a formal catalog put together by the American Geriatric Society of drugs considered risky for seniors. It is on that list for exactly these reasons. If you take it, ask your doctor about moving to a safer option in the same family that does not carry the same cognitive risk. That is a straightforward conversation worth having. Number two is so quietly prescribed that many people taking it have no idea what kind of drug it even is. Number two is antipsychotics, quetiapine, risperidone, olanzapine. These drugs were built and approved for serious psychiatric illness like schizophrenia and bipolar disorder. Today, they get handed out off-label to older adults for sleep, for mild restlessness, for the agitation that can come with dementia itself. Powerful medications meant for severe illness, now used in homes and nursing facilities on seniors who are simply confused, restless, or difficult for a busy staff to manage. The cost is steep. A 2022 study in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotics for behavioral symptoms were 71% more likely to suffer worsening cognitive decline within a year, even with no prior history of dementia. These same drugs also raise the risk of stroke, sudden cardiac death, and the heavy sedation that leads to falls and hospitalizations. They work by suppressing dopamine, a chemical tied not only to mood, but to focus, planning, and memory. Drop dopamine far enough and the brain goes slow and unresponsive. Families describe watching someone they love grow flat, absent, and distant, and they grieve a person who is still sitting right in front of them. If you or a loved one is on one of these, the first move is to ask the prescribing doctor a direct question. Why was this started, and is it truly necessary? Most behavioral symptoms can be eased without a drug at all through steady routines, reduced overstimulation, treating hidden pain, and improving sleep. When medication is truly needed, the lowest dose for the shortest time keeps the harm down. Far too often, no one ever tells the family what these drugs do to the aging brain. And now we are at number one. It is not a single drug at all, and it may be the largest hidden driver of every story I just told you. Number one is anticholinergic polypharmacy. The danger almost nobody names, and possibly one of the largest causes of drug-induced memory loss in older adults today. You are probably expecting one final villain pill. The real worst case is something subtler, the slow stacking effect of taking several of these drugs at the same time with nobody adding up the total. Polypharmacy simply means many medications at once. Anticholinergic burden is the combined weight of all of them blocking that one memory chemical together. Picture a very common situation. A senior takes a nightly antihistamine for sleep, a bladder drug every day, and a low dose antidepressant for pain. On its own, each one might cause only a small, barely noticeable dip. Taken together, they compound, and the total burden on the brain climbs fast. A 2022 study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest combined anticholinergic burden had a 120% higher risk of dementia within 10 years, more than double. And the great majority had no idea they were on anticholinergic drugs at all. No one had ever explained it to them. When you block acetylcholine from several directions at once, the brain does not just idle. Neurons start to wither from disuse, connections shrink, and the brain settles into a quiet, underpowered state that looks almost identical to Alzheimer's on testing. Here is the hopeful part, and it is the reason I made this video. Drug-induced cognitive decline is often reversible when it is caught early. Lift the burden, and many people get their clarity, their energy, and their memory back within weeks or months. The brain is more resilient than most people give it credit for, but only if you take away what is hurting it. The fix does not take a miracle, it takes a careful medication review. Sit down with your doctor or your pharmacist and have them go through every prescription, every over-the-counter pill, and every supplement, and add up the anticholinergic load. There are simple scoring tools designed to do exactly that. Once the problem drugs are identified, you can taper off what you do not need, switch to safer alternatives, and give the brain the room it needs to recover. This is the most preventable threat to the aging mind on this entire list. That is why it sits at number one. Now, everything I just walked you through, the 9 drugs, the biological mechanisms, the safer alternatives, the questions to bring to your doctor, it is a lot to hold in your head after one video. That is exactly why the complete Senior Health Vault exists. The medications worth questioning, the foods that protect the brain, the warning signs your body sends before anything shows up on a test, all of it together in plain English, the way a visit never has time for. The link is in the description below, and you can still scan the code on your screen. I want to hear from you now. Of these 9, which ones are in your cabinet right now? Have you noticed brain fog or forgetfulness creep in after starting something new? Drop your age in the comments and tell me which of these you already knew about. I read every single one. Your answer might be the thing that saves the next person who reads it. And I want to be clear about something before you go. What I share here is meant to inform and educate, not to replace the relationship you have with your own doctor. Every person's health is different. Please bring what you learned today to your next appointment and make decisions together with your physician. One more thing, your medicine cabinet is one place your body hides its warnings, your hands are another. Your fingernails can flag trouble in your kidneys, your blood, even your nervous system, years before anything else gives a sign. Most people never know what to look for. I made a video that explains exactly which nail signs are worth checking tonight. I will put it right here on the screen. Go watch that one next. I'm Dr. William. Stay sharp, and I will see you there.